Treatment for menstruation. The aim of this video is to make you become an excellent masseur or masseuse and solve any problems related to the menstrual cycle. So in terms of late menstruation or menstrual pain. Now I'm going to explain to you what each depends on, and if you will be able to follow everything that I'm going to teach you, you will be able to solve many of these problems. First, however, I'm going to show you this picture explaining to you the anatomy of the female genital system. Now, looking at these pictures from left to right, we see the pubic bone. Then, immediately after that, in pink, we have the urinary bladder. Moving towards the right, we have the uterus in light blue. And then we have the rectum. The latter, which is drawn in brown, light brown, is closely connected to the nervous system and registers every time the woman is tense and represses her feelings. So it registers all her fears. So every time that person represses her feelings, this also happens with men, but in women, going back to the rectum in women, every time that person feels tense or afraid, this rectum contracts, and this contraction, because it is closely linked to the vaginal channel and to the uterus, will affect its elasticity. Hence, we need to work on the stomach zone that is connected to the rectum, this in dermalgia, and then we have to work on the reflex zone of the uterus in the foot. First, however, I want to talk about menstrual regularity. So what makes the menstrual cycle regular? The main gland is the thyroid. This in turn is subordinated by the hypophysis, which is the main gland, which is responsible for regulating the functions of all the other glands that we have in our body. And now we have to stimulate it. Where? In the foot. I'm going to show you where the hypophysis is in the foot, and we also need to stimulate the thyroid. So we have the big toe at the very center, where the concentric circles are, we find the hypophysis for both feet. Immediately underneath that, we have the thyroid zone, which I'm drawing in red here. I will start to stimulate the hypophysis. You can do this with a free hand, that is with your thumb, or you can use a pen. Now, the exact point is where the skin is chubbier, like the fingers, the toes of children. Or you can look at the concentric circles that are found in the skin. Right in the center of those concentric circles is where the hypophysis is located. So you stimulate it well on both feet. You can use the pen if you like. 2 minutes per foot will suffice. And then you start working on the thyroid. You can also use a drop of cream if you like. These are very important. Now that you've worked the hypophysis and the thyroid, you have to identify the uterus zone, which is in the inner side of the foot, between the malleolus and the heel. This in the blue that I'm drawing here. This is the uterus zone. Don't look at the black circle. Look at the blue. Then from here we have then we have to work on the foot, and we have to work on the uterus for both the right side and the left side. Here I'm showing you zone, and then I start stimulating. In the outside part of the foot, we have the Ovary Zone. So on the left side for the left foot or the right side for the right foot, you stimulate it. So you also work on this for 2 or 3 minutes. To improve or to reduce menstrual pain, we have to loosen up the rectum zone, which is the last part of the intestine. Now you see it here, which is the last section that I'm treating in this moment. So on the left side of the person, and we loosen it up well. After working on the foot for about 15 minutes, we have to work on the stomach. Because by working on these dermalogias, on these reflex zones in the abdomen, which are fairly painful, we need to loosen them up so as to induce relaxation in the zones that are situated underneath. These are fairly painful techniques, but they are helpful because you can alleviate the tension in the uterus and in the rectum, so that where before there was high tension, this will be reduced, and the next time the person will have her cycle, it will be much less painful. And also, thanks to this relaxation, we will release everything so as to help blood circulation. Easy, right? Well, let's start with the video now, and I will show you how to pinch the skin in these zones. In fact, I was a little bit too high. Now I'm showing you the rectum. So it's actually the part just underneath that. So you have to move the slip of the person a little bit down all the way to the pubic hairline. And then from there, you pinch the skin. You pull it upwards, pulling the skin. The zone that you're working on will easily turn red because of a hyperemia, but a superficial hyperemia. So when you work like this with this technique, the area will most likely turn red. It's quite normal. Okay, this is the forte. Now we have to work on the gluteal region, as we've worked on them for other psychic or humoral causes, and now also the physical causes. As I already mentioned in other videos, we have very important nerves that go to the uterus and to the ovaries, and also to the testicles in men. By stimulating this zone, and be careful in case of late menstruation cycle, you have to really apply a lot of pressure on this zone. Ask your patient to be patient. They have to turn blue. Well, again, not blue, but you understand what I mean. You have to really apply a lot of pressure here. You can also work on them for 5 minutes per gluteus. In the beginning, it will be more painful, but slowly the pain will decrease. The gluteus have to turn really, really warm. For those who have a menstruous block, the gluteals will be very, very cold because of the lack of energy. So the entire lumbar region that we will work on soon, the gluteal region, will be cold. Slowly, as you will work on them, these will warm up. And now, work on them, and you'll notice then in a few minutes the menstrual cycle will be regular again, unless there are other more serious problems. I always ask my patients to visit their gynecologist if they have a 2 or 3 week delay in their menstrual cycle and they're not pregnant. Then, well, it can also be a late menstruation, but thanks to this massage, their regularity will be reestablished. But if they're late for like 6 months, this is defined as amenorrhea, so lack of menstrual cycle. In those cases, then, it will take more sessions to be able to improve this problem or to solve this problem. If you are able to reestablish menstrual regularity, they will be very happy because you have solved a problem that often, not even with drugs, you can solve. Now, even the pill, for example, the cycle due to the pill is not considered a cycle, but a hemorrhage, because there are no toxins involved. It is that those toxins, and now I'm going to do some psychological terrorism. If you connect on the internet, you'll find all this information. The toxins that are not eliminated with the menstrual cycle, I'm opening on a tangent now, we can have it on 2 ways, either to the blood circulation or B, in the lymphatic circulation. So if we send it in the blood supply, this toxin will in the long term cause thrombosis and ictus. If this goes into the lymphatic circuit, we are running the risk of tumor and cancer, breast cancer, and everything that you find in the counterindications of the pill. Think that drug companies are not forced, and it's not mandatory for them to write to indicate the percentage of risk. They are obligated to explain everything that can happen to you, obviously minimized, but they're not obligated to indicate the percentages. If they did, like for example, the risk of taking a pill after 20 years, I think that the majority of women wouldn't take the pill. So if you take it for 1 or 2 years, the damage is limited. In fact, there is no damage, but that you would have to ask a physician for that. But if after 20 years of taking a pill, and that doesn't take long, because if you consider that today girls start taking pills when they're 16, at 36 you're still a young girl, and that's 20 years. So that's whether you really need to talk to a doctor, at least take a break or stop altogether. But that's only my personal opinion, and I don't want to contradict what your physician is saying. I just want to warn you so that you don't take it too easily. After this long tangent, now we go back to our work. Now, as I was saying, we have to unblock the lumbar region. We have to work both using this technique that you're seeing here, this palpebral technique, and this will also tend to warm up the zone. You work also in the technique, the stripping technique that I'm showing you here. Here it is. Exactly. You start from the spinal cord. If you remember well, this was also taken from another video. And from the center, you press towards the side. It's a fairly strong pressure that you need to apply here, so you can loosen up the muscles that tend to connect the lumbar vertebrae. So you do this well on one side first and then on the other. You can do this 5 to 10 times per side. Okay, so in conclusion, you need to remember that when a person or a woman who has menstrual pain comes to you, you need to focus on the rectum and on the uterus, which causes this tension and causes this pain. If it's a problem of menstrual irregularity, then you have to work on the hypophysis, the thyroid, the ovaries, and in the foot. And you also and always need to work on the gluteal region and the lumbar region. You have to really loosen them up so that your work will be perfect. And this is all, again, put all this into practice and do not neglect any of the steps that I've shown you.